Good morning, everyone. Welcome to our session of this program called as Back on Track. Today, you might see that we have a very special thing in our frame, which is called as a foam roller. Okay, so most of the exercise that we are going to do today is using a foam roller. Also, a foam pad. Okay, but we won't require a foam pad. But in case if you don't have a foam roller right now, just have a foam roller with you and then set for the exercises. Okay. For the first exercise, for the warm up, you might not need a foam roller. So let's start doing the first exercise for the warm up. Just 10 reps, which is very, very easy. Now we are going to do a cobra to the child's pose exercise and 10 reps. Okay. Let's start without wasting any further time. Okay. So go into the child's pose, feel that stretch there. While we are doing the warm up, I'm going to quickly tell what are the things that we are going to focus today. Okay, so using a foam roller, we are going to do some recovery exercises. We are also going to do some upper back mobility exercises. And we will also learn how to actually do activation exercises as well. So today's session is not only about mobility, activation, flexibility, and recovery, it actually involves everything at once. Few exercises will involve mobility using a foam roller. The other two is going to be an activations, also some kind of burn in the posterior chain with using a foam roller. The other two is going to be how to use foam roller when you're on recovery days. There are multiple muscles and multiple joints that we are going to work today on. 3 more reps as a warm up, and then let's begin the session. One more rep. Good job. Good job. Let's do a open book stretch. Very easy, but helps a lot. Let's get started. So the upper leg will be at 90 degree. The lower leg is going to be straight. Do not raise your right knee up. Open the chest. Might also feel a stretch in the anterior shoulder. An amazing stretch to start the day. Okay. 4, 5, 6, 7, 8, 9, and 10. Good job, guys. Let's do it on the opposite side now. Ten reps. Breathe in and breathe out. Do not hold your breaths. Three more reps to go. One more. And relax. Hope everyone has grabbed their foam rollers and we won't require a foam pad anymore. So I'm just going to drop it off. And let's begin the first exercise. That is a mobility exercise for the upper back. Okay, so we're going to do something called as a thoracic extension exercise. Now, when it comes to any aches and pains like upper back pain or low back pain involving the facet joints of the lower lumbar as well as the upper lumbar. This exercise is going to help us a lot. Why in case of lower lumbar? Because when the upper thorax mobility or the mobility at thoracolumbar junction is good, the load actually reduces. With the load that happens or comes on the lower lumbar area reduces a lot. Okay, so this exercises is very much helpful specifically for the people who are into texture, because that actually gives a very slouching posture and a flexion posture, but this is completely opposite of that. So moving into an opposite direction is very, very important. Okay, so let's grab a foam roller and lie down with your face up. Okay, keep a foam roller at the thoracolumbar junction. Okay, somewhere here. Okay, so this is a mid thorax. You will have a thoracolumbar junction there. Okay, keep your knees bent, head and neck supported, clench your hand fingers like this, and head and neck supported, elbows together. Do not raise your feet, do not raise your hips from the floor. Okay, just try to reach the head down on the mat. So there you go, 1. And breathe out, 2. Feel a good amount of mobility and stretch into your upper back. Okay, 3. Keep doing it, guys. 4. 5. Breathe out when you reach your maximum limit. 6. 7. 8. 9. 10. Now for the next one, for the variation, you can also shift the foam roller a little bit in the mid back, then do the same exercise. Going to be working towards your T6, T7 spine. 2. 10 reps here too. Support your head and neck. Okay, don't let it just go in the air. You don't have to use any muscles in this exercise, because this is not a strengthening or activation exercise. This is a mobility exercise. 5. 6. Things that you should avoid is lifting your hips off and support your head and neck properly. 1 more. Hold there for some time. 5 seconds. Breathe out. 5, 4, 3, 2, 1. Good job. Slowly relax. So that was our mobility exercise. The next exercise that we are going to do is a glute bridge with an adductor squeeze. Again, this will work on the posterior chain as well as a lot of activation into the stabilizers of the knee. Okay, we have did the glute bridge exercises before in our program and our sessions. This exercise is just involving a foam roller to get that extra activation. So place a foam roller in this way, any way is fine. It is in between your thighs or just below the knee. Not give it like this, just keep it in between the knee. Again, hip width apart. You're gonna squeeze the adductors muscle, okay, as you bridge. Now, again, activate the core, everything remains same. You do not arch there. You do a posterior tilt, activate your core, squeeze the foam roller with your thighs in the inner direction. Hands on the side, Keep your buttocks activated, squeeze the buttocks, do a posterior tilt, and go up. And keep squeezing. 1. The only difference between the glute bridge that we have done in the past sessions and this is you're actually squeezing a foam roller in between here. So you're activating all of your adductors muscles too, and a VMO also. So keep it activated. 3. Good job. 4. Keep squeezing. Do not leave. Keep breathing. Do not hold your breath when you squeeze. Okay. Keep your core all active. 5. 6. 7. Keep that core active. Don't let it loose. Don't let it loose. And squeeze the buttocks. 9. 10. Good one. Let's do one more set. So many cues. Do not forget the only addition that we have done is adding a foam roller and squeezing it as much as hard as possible. The rest of the things remain same, okay? Let's start the second set. 8 reps this time. Squeeze the buttocks, hands on the side, and go up. 1. Keep the core active. 2. Squeeze the buttocks. 3. 4. Keep pressing the feet into the mat and go up. Keep squeezing the buttocks. Do not arch. Keep it all active. 8. Let's do 2 more. Keep the core active. Do not lose it. Squeeze the buttocks. And 10. Good job. Felt a good activation in your muscle. I'm so sure. Okay. So the next thing that we are going to do is a hamstring bridge. Okay. The only thing that we have to change is the foam roller position. It is a difficult exercise. In case if you are fatigued or in case if your hamstrings are cramping up, do not try to do this exercise. It's a little tricky and difficult exercise. Okay, again for your hamstring, what remains same is now you're on a foam roller, which is an unstable surface. So in case if you want to work on your hamstring, you have to really work hard. You have to really get that core stabilized. You have to really get the good control in your hamstring muscle to roll it around, okay? Let's give it a try. In case if it's very, very difficult, you might just do a single leg hamstring bridge instead, okay? Or an elevated. In case if you have a stool, you can place your feet on that and do a hamstring bridge with that. For this exercise, place the foam roller as I have placed it under my foot. Everything remains the same. You're going to activate the core, hands on the side, squeeze the buttocks, and go up. And you're going to roll. 1, 2, 3, 4. When you're doing this, make sure you're not dropping off the core, okay? Very nice. 4 reps done. 5, 6, 7, 8, and down. Good job. This is going to burn your hamstring. The only thing is, in case if your core is not stable, you might feel some discomfort coming into your back. So make sure your hamstrings are properly activated and they are working amazingly. And this might also give you some cramps for a beginner. Okay, let's do the second set of 8 reps again. It's an unstable surface, going to be a little difficult. I want you to tuck in now, squeeze that buttocks, lift it up, and there you go. 1, 2, keep the core active. 3, not loose, keep the core active. 4, 5, 6. You might lose balance in between. Just take some break and do that again. 7, 8, 9, 10. Good job. It's an amazing exercise and a good hamstring burner. We're going to take a 10-second break there. Feel free to just keep the foam roller under your knees and do some 5 reps of diaphragmatic breathing. Okay, breathe in. Breathe out. Breathe in. Breathe out. 3 more breaths, and then we start our next exercise, which is the part of the recovery exercise. That is called, we're going to foam roll 2 muscles. You're going to foam roll your quads, you're going to foam roll your glutes or TFL, and which is connected to your IT band. Okay, just 2 more breaths. A 10 to 20-second break is very much required after the hamstring bridge. That actually burns your hamstring a lot. 1 more breath. Good job. Now let's start our next exercise, which is foam rolling of your quads muscle. This time we're going to place the foam roller here like this, such that the foam roller pressure is going on your front thigh muscle, which is a quads muscle. Okay. Now we're going to go in a plank position. Just keep the foam roller over just below your hip joint. Okay, and then you're going to keep the opposite leg like this as I am doing, and then you foam roll. So you go 1, 2, 3. It's going to give a lot of pain and tenderness on your quads, which is required. Okay, and do it 10 times. 7, 8, 9, 10. Good job. Switch the sides. Bow your hip to just above your knees, okay? You don't have to actually maintain any kind of form or anything in this exercise. Just make sure you're hitting that right tender points, okay? Because this exercise is for the recovery, for the foam roller. You're not doing any mobility, we're not doing any activations. So don't worry too much about the forms, just get it right and feel the muscle pain. Okay. 7, 8. It's gonna be painful. 9 and 10. Good job. On the weekends, once you're having a plan for yourself from Monday to Friday, always do not forget to foam roll on the recovery days. That can be your Saturdays, can be your Sundays. Do not forget to foam roll these quads. Do not forget to foam roll your glutes. So the next thing which I'm going to teach you is foam rolling your glutes. Okay, very, very easy. You're going to keep the foam roller like this, and just in case, and the glutes, you have different kinds of muscle. You have a gluteus maximus, you have a gluteus medius. The thing which I'm going to teach you right now is basically used for glute med. Also there is a muscle called as tensor fascia lata. These both the muscles actually inserts into and form an IT band which runs laterally on your knee, okay, which gives a lot of knee stability indirectly by using these muscles. Now in case of, we have done prior session, we have been engaging your posterior chain, your glute med, which causes a lot of using of these muscles. Okay, so but for the recovery, you need to also foam roll these muscles so that the knee stability improves over a period of time. Okay, so for this, you're gonna go here, just a little oblique on the foam roller. You can go like this, push the leg in front, okay, and 1. So this is working on a TFL. It's a bit oblique. You're not exactly facing up. You're not exactly facing on the side. It's a little bit shifted towards one side, okay. And you might find that good sweet tender point there, okay. You can keep your leg here or you can keep it here based on how stable are you feeling. You go and release that glute med, okay? 6, 7, 8, 9, 10. Good job. Let's do it on the opposite side now. Okay. Try to keep that foam roller exactly at your glute med. Now, how would you understand which is my glute med? It's very, very basic. Okay. Now, remember when you do clamshells, remember when you do that against the wall, that's a place where you feel that the muscle is being used. That's where your glute med is. Okay. 5, 6, 7, 8, 9, 10. Good job. The last muscle connected to your TFL is an IT band. We're just going to go shift on the lateral this time. We're not going to go looking front or looking oblique. We're going to go shift on the right side. The IT band actually is on the lateral side of your leg like this. You're going to foam roll all of it. Okay. Have to roll down and up. 2, 3, 4, 5, 6. Maintain a good balance because foam roller is a very unstable surface. 7, 8, 9, 10. Good job. You're actually going to enjoy when you're foam rolling. You're going to have lots of pain, but it's good for your recovery. Might not feel you're giving lots of effort there, but it's amazing. It's not going to be very, very tiring, but it's going to be a little painful. Okay. Get on the lateral side. 1, 2, 3, 4. This is the last exercise for the session. 3 more rolls. Good job. Then you have rolled your IT band. Okay, let's do a quick cool down with the thread and needle. 1, 2, 3, 4, and 5. As you guys are doing the thread the needle on the opposite side, I'm going to quickly summarize today's session. Meanwhile, you guys keep doing the thread the needle on the opposite side as well. In today's session, just to recap, we have done everything with using a foam roller except the warm-up and the cool downs. Okay. For the warm-up, we have done a bit of mobility work on the lumbar as well as thoracic region. Later in the foam roller, we have also learned mobility, how to get your thorax as well as thoracolumbar junction mobilized and keep those facets healthier. We have also done posterior chain activations, that is a glute bridge, by keeping a foam roller between the thighs and then pressing. So you're going to feel a lot of knee, inner thighs, as well as to improve the single leg stability in the exercises that can come further into the sessions. Okay. Now, the next thing that we did was posterior chain activation again, not only glutes, but also hams. We have done a hamstring roll with placing your feet on the foam roller. Kind of difficult exercise. In case if you're not ready for the exercise, you can regress it. Okay. Now, in that case, one more very, very important thing, if you feel your core is not active and it's not able to hold the position there, pause, wait, it's fine. Regress the exercises, and probably after a week or two, then progress to this exercise, what I have taught you today. The next exercise that we have done, basically, I would say is just a recovery day exercises, releasing your muscles for, a lot of soreness, post soreness after the whole week, once you're completely sore out of your walks or runs, or after doing any gym session or exercises. Please feel free to foam roll certain muscles like quads. I've shown you for quads, I've shown you for TFL, for the glute med, also not but also an IT band, which is somehow connected to your glutes, to your knees, which maintain your knee stability. That's all for today's session. In case if you have any doubts, please feel free to put it in the comment box, and hope to see you all next time. Bye bye. Have a good day.